gosh. All right. Hi, everyone. My name is Hannah Sisla, and I'm here with the Arm Hug podcast. So I have an incredible guest here today. I met her at Sancio. I think it was the J&J Healthcare Hackathon. And this is Molly Bronstein. She is a nurse. She is a public health student. She's an advocate for nurses and policy and everything because she's smart and she has a lot to offer and has a lot to share. So I'm excited to have you on, Molly, because I think you exude so much passion for nursing and people
Well, thank
just
you.
gravitate towards that.
Thank you.
So,
Well, I went into nursing at a really, really interesting time. So, I started my nursing education in the late 90s and then finished by 2004. And in that time, we saw so much development of NANDA. I don't know if you remember NANDA or if it was like a dinosaur already, but it was the North American Nursing Diagnostic Association, something to that effect.
wow,
And there was this whole idea that nurses needed to take ownership of their interventions and the evidence as to why we do what we do. And it was so empowering and
right.
exciting. And at that same time, I was working as a research assistant at Case Western. They have an amazing, wonderful nursing program, the Francis Payne Bolton School of Nursing. And I was a research assistant for a doctor, Dr. Jean Cranston Anderson, who has become legendary with her research. And so I got the opportunity to enter into nursing legitimately as a part of a World Health Organization study. I mean, I cannot imagine. I was so lucky. And I literally just was knocking on doors. I had just moved to Cleveland, having transferred from Villanova University's nursing program. And I was just knocking on doors to find work. I
That's
needed to
awesome.
I needed to find work, and I was like, "Does anybody need someone to do data entry? Does anybody need someone to, like, anything, answer the phone, anything?" And, they needed someone to approach, women on labor and delivery to see if they would be open to participating in this study. And when I first started on the study, I I was what, like 19? Like I really couldn't even wrap my head around fully like what it meant that we were doing. I knew we were doing something with skin to skin contact therapy. I knew we were um measuring cortisol in breast milk, but like
Mm,
I was a kid. I was really a kid. I The magnitude of what we were doing, I had no idea. But everyone in that office
mm,
was so excited to be there. And there was certified nurse midwives, there was NPs, there were doctorate, there were, PhD nurses there. It was like at the very beginning of the whole idea of a doctorate in nursing practice. Like that was a very brand new concept at the time. It was also the very beginnings of the idea of the accelerated nursing program for post baccalaureate trained nurses. And it was the very beginning of Magnet. So it was a very powerful time to be going into nursing. And I think that my experience then generated a sort of momentum
makes
that
sense.
that never faded. It's like whenever I would have an experience at work that was like less than optimal and where I was feeling like what did I get myself into? Like why am I here? Why am I doing this? I would go back to that place of being, 19, 20,
Yes.
and being a part of something so much larger than myself. And then and yeah, so it's been very rejuvenating in that way, and I think it's really helped me be so passionate about nursing professionally. Was having such an incredible, like, first step into being a professional. Um, and the bonds I have with the women from labor delivery, from high risk antepartum care that I worked in as well, it's remained. It's been 20 years now. So
Wow.
um, I really owe so much of what I know to those really formative years.
Yeah, because not every part of the job is gonna be fun all the time.
Oh
How
yeah.
much do you think that's changed today?
Uh, the fun or the
The fact that you felt that you were entering into something that was booming at the time.
I don't know if it was booming so much as it was sparking. It's like these little sparks that are just like
Yeah,
like ouch, ouch, ouch.
right.
Um, because it was a time where so much was very conceptual and so little was actually had materialized. Like now, when I talk about NANDA to most people have no idea what NANDA is because it's
Mm.
it's died, it's fizzled, like that spark has gone.
Oh, man.
Similarly, I saw a thread not long ago on about Magnet on LinkedIn, and it was really tearing Magnet up, and it was like saying how disappointing Magnet has been, and I really had to check myself because I did contribute to that thread, and in a capacity that I was disappointed with Magnet. And then I had a really good conversation with a nurse, with a handful of nurses actually in Washington, that really made me take a double take on what is Magnet and versus how do we experience Magnet within the health centers that we're practicing. Because that was one thing that, like, I didn't give enough thought to, or at least I hadn't known
Yeah.
the the nuance there. You know what I mean? And it really is nuanced. It's not cut and dry. And after I had these conversations, I did have a whole new appreciation of Magnet, and I do feel more strongly that Magnet is something we can lean on professionally. Um, Whereas before I had my reservations.
And this is something that people can join now, you're saying? Magnet.
For Oh, well, I mean, well, yes, of course. I mean, Magnet um is a certification that
Mm.
a health facility, that a hospital can get, that's nurse driven. Um, what I think is important for people to realize is that a facility being Magnet doesn't necessarily mean that the facility um is going to envision their Magnet status the same as the
Mm.
nurses who are working within it are going to envision it. So I think it takes a lot of time to create a conversation to see where do we want to go from here. Um I'm having a lot of thoughts recently on why are we not doing more to grow nurses from within.
That's really good.
There's a huge expectation that I think in order for a facility to become Magnet, it has to have like 80-90% nurses are baccalaureate trained.
Wow.
And um I I think at Penn you might need to actually be baccalaureate trained to be hired, in which case they're requiring 100%, but it's not like I don't necessarily feel that 80 to 90% is just random. I've been thinking more in terms of the importance of mentorship and the importance of diversity. And I don't think that we're getting more ahead to say that 100% of the nurses are baccalaureate trained. I think we actually have a stronger workforce and a stronger sense of community when we do have the 20% who aren't baccalaureate trained and we're investing to get them there.
Yeah.
And that it's not necessarily baccalaureate trained. It could just be continuing to learn and grow. Like, why do we have to say it's baccalaureate? Like, because another issue that we have with all of these programs to support nurses is we also are having these bottlenecks where you have a lot of nurses with master's degrees and no place to use them, at least no place to justify using them. And I say justify because we can't negate the fact that we live in America, right? So you can't be an American and be told that you cannot monetize your abilities and your skills and your education.
Right.
Whereas in nursing, that's what we've been told for so long, that we want you to be educated, but we don't actually want you to use your knowledge. And we don't actually want you to use that education that you're getting, but we want you to be highly educated, but we don't actually want to pay for it. We don't want you to have that expectation that somehow by becoming higher educated that you're deserving of compensation. Whereas you don't see that in any other professions. You know, if you're in finance, the more time you're in finance, if you go from one bank to another, you're not expected to take a pay cut. In fact, you often get compensation that entices you to go from one place to another. If you're a teacher and you get a master's or you get a PhD, your compensation increases significantly. Whereas in nursing, in a lot of times when people get a master's degree, their compensation, if they want to go into that role, their compensation decreases. Like if I wanted to
Oh,
be in a role of a master's in public health in, let's say, trauma prevention, like promoting Stop the Bleed, promoting BLS in communities, um, tackling gun violence, policy, all of these things, I would be expected to take a cut in pay and to take a cut in benefits. And I don't believe that we expect other professionals to do those things. So I
maybe
think these
that's
are
why.
things, yeah, I'm sorry.
Oh no, I was gonna just say maybe that's why there's so few doing it.
Oh, yeah. And I think it also contributes to the burnout because there's this moral injury of why am I not doing more? Because one of the narratives that needs to be owned and shifted and pivoted from is the idea that you're only a nurse. Like that's something in our society, in our culture that we really need to step away from because none of us are only nurses, and the sacrifices that we've made of our bodies and our psyche to do this career is tremendous. And it's one of the reasons I sent you that link. So I feel like I like blew up your LinkedIn with like all these like books and stuff.
It's
But like
great.
one of the ones I sent you was The Women. And I think I also sent you the podcast from the author. But one of the things we're really going to have to talk about moving forward is the trauma of COVID. And
Mm.
that there are cohorts, entire cohorts of nurses, of physicians who have been irreparably hurt by what they experienced in those first few years of COVID. I mean, they were completely unprepared for the emotional and physical expenditure of what was expected of them. Um, and much like how we look at the first responders from 9/11 and the steel workers from 9/11 and the veterans from past wars, we owe it to health professionals to create avenues that they can get the care that they need so that they can feel whole as human beings. And if they find the ability to go back into healthcare, fantastic. That's amazing and wonderful.
Yeah.
Not everyone will.
No.
Not everyone will, but we should create a place of inclusivity so that people don't feel afraid to return and that people have an opportunity to feel healed and whole and well, and they can make that decision for themselves about what's best for them. But I think that um, there were a lot of nurses who were not very experienced, who were coming into the situation of COVID like very unprepared. I'm very lucky because I was in a very traditional nursing education program. I ended up doing my education and didactics through Kent State. And there was a lot of push that during those years that you were in nursing school, that you were also working in a hospital, doing anything, working as a nursing assistant, working as a tech, whatever job you could get, you were supposed to be working in a hospital. And the idea behind that is that healthcare systems and centers are so collaborative, and they really wanted us to feel a part of this community, not as a nurse but simply as a part of the community before we went forward as a nurse. And I think that during that time it really helped to promote resilience and communication strategies and an understanding of hierarchy and an understanding of um, chain of command and an understanding of residency programs and fellowship programs and who you call for what and the importance of the janitorial staff and the importance of linen service. Like, there's so much that
Yeah.
goes into what we do that it's really nice to have those years when you're studying to be incorporated into that community before you go through those doors with the power and the authority of a nurse. I think that if you don't have that, then it's very hard to articulate when you need to be assertive. It's very hard to have that voice when you've just been kind of tossed in as a nurse without having been a part of that community before. And with COVID, there were so many nurses who had no idea how they ended up there. It was like they fell through a vortex of like the Wizard of Oz, and all of a sudden they were just surrounded by people dying all around them. I
Right.
mean, and the what that does to the psyche, we don't fully know and realize yet. But we have to start talking about it, and we have to start being more creative in where we're looking for the data. We need to start asking, we always talk about like nurses aren't in these focus groups. Like when they're building the hospitals, when they're designing these centers, nurses aren't in the focus groups. And I feel like we need to start making our own focus groups and collecting our own data of how we experience moral injury and how we experience the paddywhack machine that we call our career. I think we need to take some ownership of that on on our own and not wait for organizations and facilities to start doing it for us.
Yeah. Because I was gonna ask, like, what do you think of what the next generation has to do now to just be able to do what you're doing today, or to even have the experience you have? Like, do you think it's good enough? Are there other resources you guys should be using? You mentioned podcasts a lot. Is that something that you share with the community you're in?
I try to. I
Mm,
I'm not as tech savvy as I think I would like to be.
got it.
I am someone who yes, like is talking about podcasts and Audible at work professionally. And I do have to say I had this like funny experience with a medical student.
Oh,
I think it was last week where he was here. I think he was watching like a septoplasty. It was something like relatively, basic, but he had this great energy where he really wanted to help. He wanted to help everybody, and he was very available with like wiping down the operating room bed and remaking the bed. He was someone who did such a great job of jumping in. And
it's the
so
best.
I told him, I was like, I'm so impressed by you. I definitely went into like mommy mode and I was like, I'm so impressed with you. I'm gonna give you like my gifts, and like these are my gifts. These are the books I want you to read. And
Oh,
when when I see you again, I want to know like what you think about these things. And he was so cute. He took out his phone and he was like taking pictures of like my Audible list of different things. But I I do think that's what um is needed for the future.
yeah.
I think that nurses, PAs, physicians, surgeons need to spend more time together. I'm so lucky to be in surgery. Oh my gosh. I mean, it really um, promotes healthy communication. I realized that that was not always the case.
Mhm.
And I also realized that it's not necessarily the case everywhere.
Yep.
I have been in plenty of community hospitals where in surgery nurses don't have a name. You're referred to as nurse, similarly as anesthesia is simply anesthesia, and the revolves around these surgeons. I have been in that experience and context, and I realize that that exists, but I'm very fortunate that my work at Penn has not been like that. So I'm super, super lucky about that. And for the brief period of time that I was at Temple University, also, I had such a positive experience with the surgeons and the coordinators there too. So, I mean, Philadelphia, I'm really lucky to be a nurse in Philadelphia because between Penn, Jefferson, Temple. Oh, this is my little girl. Hey, mama. Hey.
Hi.
What do you think about mommy being a nurse?
I think that since you are a nurse, Lily and Violet want to become doctors.
That
Oh,
kind of
that's amazing.
that's something that goes on. It's
Yep.
yeah. All right, mommy will be done soon, and then we'll talk more. Okay.
Also, you're a nurse, you always know what to do if one of us gets hurt.
Oh well, that's
It's so true.
Like, like nurse senses activated.
Yeah. Superpowers.
it's a superpower. Thank you, honey. Thank you. Love you too, sweetheart. Sorry.
No, that's great. That just shows you how important it is to pass it on, right? That energy,
Pay it
the fact that
forward.
you also, yeah,
100%.
absolutely.
So I think we need to do more casually together. Like it must seem hokey, but like, yeah, we should go on like team building, like camping stuff and like go to camp
Yes,
and
yes.
and I I think that we all have so much to offer each other. Um and I think that the AMA has been amazing
Oh, that's
as a
good.
lobbying group. The American Medical Association has been incredible. And I think that we should use it as an opportunity to learn from them instead of pushing it away as, well, you're in medicine, you do that, I do this. I think that physicians have been great at validating our evidence, and really creating space for collaboration. And I think that when nurses do it the other way,
Right.
right, we have a tremendous amount to learn with regards to networking, management, and policy. You know, they're creating space for how we appreciate a bit of crunchy granola. I think we need to create space more for how medicine has been able to provide leadership and boss with regards to the American experience. And I think that within that, we're going to find some balance.
Yeah, I agree with you.
So the question is, with all of us working all the time,
Yep.
how are we going to get away to do camp? But I think it's helpful to have, we might need to do camps like in our healthcare settings, like kind of like take on a bit of Google. If you're expecting people to be working all the time,
Right.
then maybe we need to be a bit creative on where we're putting these team building efforts.
Yeah, and
And
what would that look like? Like, would it be like a yoga class? Would it be like a mindfulness class? Like, what are those things? Or is it a workshop?
all of it. Oh my God.
Yeah.
I think we should do all of it, because all of it has a place.
Yeah,
And
it
there's so
does.
many different learners. There's so many different types of learning, types of communication.
Mhm.
In order for us to validate what we know, we have to create space for all of it. And we have to say, even if one workshop only has 4 participants, we're still
Right.
calling it successful.
Right. I like that.
You know what I mean? Like,
Yeah.
just because something doesn't have a turnout of like 50, 70 people,
100, yeah.
100 people, doesn't mean that it's not successful.
Absolutely.
If the experience is such that it creates a network that provides mentorship and communication and facilitates dialogue, then that was
Yeah.
successful.
Yeah.
That was successful. That's what we need, because it's from that core of 4 people
Yeah.
that careers are built.
Yeah. It's going to cut me off now soon, but I just want to let you know that because we are at our 30-minute mark. Oh
Okay.
my gosh, I feel like I could talk for hours with you.
Oh my God. Well, whenever you want to get together,
Okay.
like, just let me know, and
Okay.
definitely listen to the podcast with, I think it's Kristen Hanna, the writer of The Women.
Yeah.
If you get a chance to listen to The Women, it will really resonate as far as when you think of it. Let me plant the seed with regards to COVID.